From Eden County in the district near Grand Ledge. I have a couple of questions for you, Mr. Walberg. One is, you, on the one hand, you're opposing the supposed, which I do not agree with, Medicare cuts. On the other hand, you talk about government takeover of health care. Well, is not Medicare government health care or government managed health care? That's one question I have. The second question I have is, if I cannot afford health care insurance, how can I afford health care savings plan? You mentioned that was part of your plan. Where would I get the money to save how much for an operation that might cost $50,000, $100,000? Where would I get that money to set aside if I can, if I can even afford health insurance? I have many other questions. You raised many issues, but in fairness to everybody else, I would appreciate answers to those.
I appreciate that. First of all, Medicare is a government program. You're good. Quick learners. Medicare is a government program. And that's part of the problem in thinking that we're going to take over the entire healthcare system when Medicare is broke. It's filled with fraud. There are actually more turndowns of payments under the Medicare insurance, called insurance. Literally, there are more and statistically proven more turndowns under Medicare than there are under private insurance. Wonderful. There are a lot of people who have. There are a lot of people who have, and if you've got no complaints, that's great. In my office in Washington, that was one of the higher. Social Security was number one, another government program. Number one issue of complaints that came into my office. Number two was veterans issues. And number three was Medicare, Medicaid issues. I'm just giving you my answer and my understanding of it from the experience I've had with it. So it is a government plan that I'm not comfortable with. Health savings accounts, that was only one component. The best way to have health coverage, and hear me carefully on this, the best way to have health coverage is to have a job. If you further restrict employment in this state or in this nation by adding additional costs to businesses, job providers, you're going to have less jobs and less opportunity for people to care for their own medical insurance needs. Now, I would contend one of the best and the first steps to take is to build an economy. In Michigan, 4 years leading the nation on unemployment. 4 years. Isn't it enough?
It ain't over yet.
It ain't over yet. Because we are not opening the doors to business in this state. We're not saying you're welcome. We have high regulation, high cost, high taxation in this state. That has to change. So my plan says, health savings accounts, yes. When you have a job, you can start contributing that more and more. But if you don't have a job, no, I agree with you. It's hard to contribute if you don't have money to do it. But on the other side of the ledger, I said we had a refundable tax credit in for the purchase of health care. So if you're unemployed, under my plan, you could go to the insurance agent and say, I need to buy insurance for my family and my kids. The government is going to supply me a refundable tax credit to pay for it. Give me the binder. I take the binder and I send it to the appropriate government agency. They send a check to the insurance company, not to you. They send a check to the insurance company, covers your cost. Bottom line is, it gives the opportunity for people to have control of much more of their health care concerns than some do now, and it does not add one tax increase to the mix. It allows people to be accountable and responsible. Next. We get that mic working?